So I was super excited to be able to get the Relivion device for the first time last month. Those who know me know that I have wanted to try out the Relivion for a really long time. I am a big proponent of non-invasive medical devices for migraine. And this one is particularly interesting because it stimulates both the trigeminal and the occipital nerve. So I'm going to do an unboxing and we're just going to kind of walk through this. So I'm going to open the box up like this. It comes in this neat little white box. It's all very nicely packed up. And then you can see this is the main container. I'm going to put that to one side for a moment. And in addition, they have this. I'm just going to open that up for you so you can see these are the pads that are going to be used with the device. So there's lots of extra pads. And then in addition, we have the handy dandy quick start guide. So I'm going to put this outer box to one side for right now so that we can look inside the Relivion container. This is a wonderful travel container, and let's just open that up. And you can see in the travel container that you have what is the headset. That is going to be this device, which we're going to size to my head. You have this section here where you can store the pads for the device. And in addition, right in the middle, you have this little box which contains three things. So one is the charging cable, the plug to go with it. Make sure that you use the right plug with this device. And then this is a little spray water bottle. You're going to need to dampen the pads using the water out of this bottle. So I'm going to put this container to one side for right now. And what we're going to do is this has to be sized, first of all, to my head. I do have a rather large head. Please don't laugh. So I know that I'm going to need to go up pretty high. And inside this device, I don't know if you can see it on there, but right here are numbers. The numbers go from 0 all the way up to 10. So I'm going to put it around about 7. And I'm going to do the same on both sides because I don't want the device to be lopsided. So that's kind of a guess for me. I may be able to make it a little bit tighter or looser, but the goal of this device is to make sure that it's snug around my head. It cannot be loose. So I've just set it for that right now, and then we'll see what happens later. Now you'll see that you have this little nose container here. It kind of supports over your nose. If, like me, you're very sensitive over your nose, you can remove this if you want to, but again, you need to make sure that the headset is nice and tight. So I'm going to leave it on for right now. That's especially true if you wear glasses. Trying to wear glasses with this little nose support can be a little bit tricky. Okay, so I'm going to take this water bottle, which I've now filled with water. You can use regular tap water. It doesn't have to be distilled or bottled water, just regular tap water. The device is already charged, but make sure that you keep it charged at quite a significant level. You probably need to have a minimum of somewhere around 35, 36% in order to start an actual session. If it's not charged enough, then you'll get a warning on your phone and you'll be able to see that it's just not charged enough. But it just charged pretty quickly. So now I'm taking these little pads. You can see they're little white pads. 2 of them are rectangle, and then we have 4 kind of triangle shapes. And you can see I'm going to put them in here and putting these in here. They're very soft. So if you are sensitive to adhesive, you don't need to worry because these are not adhesive pads. You can see these rectangle ones I'm going to put in this part. This is where it's going to press against the back of my head. Now, at this point, I should also tell you that this device comes with an app. So you need to open up the app when you have the device ready. It is called the Relivion MG app. And this app provides a portal not only for you to use to start your sessions, to record migraine attacks, but it also enables your doctor or other healthcare provider to see what is going on, how many attacks you're having, how strong a stimulation you're using, and to interact with you, which is pretty cool. So I'm going to take the water bottle right now. And what you have to do is you need 5 squirts of water for every pad. So there's 4 pads here, 5 squirts of water. If you're like me, you want to kind of pull it out a little bit and you'll see the water went everywhere. So you don't want to do that. You want to put, and it's still going to drip a little bit, don't worry, but you want to put the water bottle really close into the pad. You can even push it against it until you have 5 squirts per pad. This is for the ones that are going on the front, the triangle shaped ones. If you try to do it too fast, the water will drip. So just kind of take your time, and especially while the pads are dry, it takes a little while for it to soak in. There we go. I'm just gonna give an extra one there. 5 on there. Now for the ones that are kind of rectangle shaped that go at the back of your head, you need to do 10 squirts of water. So I'm going to do that down here. And again, put the nozzle of the water bottle right up against the pad so that the water doesn't go everywhere. And almost done with this. Now these pads need to be changed either every time you do a session, or sometimes they'll last for 3 or 4 sessions. If you have very sensitive skin, which I do, you may want to make sure you change them every single time. That may help relieve some of the sensitivity for that. So you can see that this is now ready. There's a little bit of water on the outside, that's fine. In case you're wondering, this is a magnet. So just got to pull it apart and it goes back together. This is where it's going to sit at the back of your head. I'm not going to take the nose support off at this point, but what I am going to do is show you the power control. So when you push this button, this is the power control, and you'll see a little blue light. That shows that the device is ready to be used. If it is not blue, if it's orange, that means it just needs to be charged a little bit more. Now next to it, there were 2 little buttons right on top of each other. Okay, when you push one of them, it's going to make a stronger intensity for the stimulation, and the other one is going to lower it. So I'm going to put this on my head right now. You want it to sit right above your eyebrows. You can see, here's my eyebrows. It's going to go right around the back of my head. I have a lot of hair, so I tend to push my hair up a little bit. And you can see that's pretty snug. Okay, so you may have noticed at this point, I have my glasses back on, and I actually removed the nose support from here because of my glasses and because it triggers a very tender spot on my face. You do not need to remove it, but it is an option to do that if you are like me. So I've got the device and I am turning it on now. So that's this button in the middle. It should be blue. And then you can see these 2 buttons here, what I'm going to use for the intensity. But at this point, I need to open up the app. So this is the Relivion app that I am opening up. I have already paired it with this device, so there is a process to go through it. And you'll see here that it says, welcome Shoshana. There is a start wizard. And up here on the top left, it says the Relivion is ready for use. So when you first open the app and you first turn the device on, it takes a few seconds for the app to recognize the device. You have to wait until it says ready for use. It also has here doctor's instructions. So this particular device is FDA cleared for abortive treatment, acute treatment. But some doctors are also prescribing it off-label for preventive treatment, and it is in clinical trials for preventive treatment. So that's where you're going to see the doctor's instructions. Underneath that, you'll see insights, and I can go over some of these things later after I've showed you how the device is actually going to work. So I'm going back up here where it says, hi Shoshana, ready for treatment. So I am. I do not have a severe migraine right now. So I'm going to push the start wizard, and it asked me that. Do you have a migraine now? And if you say yes, it is going to take you onto an abortive treatment. If you say no, it will take you through a preventive treatment. So the abortive treatment is 40 minutes and the preventive treatment is 20 minutes. Now, if you're like me and you have migraine attacks that last days and days and days, that's not really what this question is asking, unless you want to do the 40 minutes every day. But for myself, I would say yes if I'm having a discrete attack and I'm managing to treat it within the first 30 to 60 minutes. After that, it is less likely to work for me. So for right now, I'm going to say no, I do not have a migraine. I'm going to hit next. This walks me through soaking the electrode pads, which I've already done, so that's not important. So what I'm going to do now is I'm going to push the top button, which is going to start the stimulation. If it is working correctly, you'll see the numbers are going up, and I can start to feel some intensity on my head, the back of my head and around my forehead. If it is not connected properly, so if you don't have enough water, if the device isn't tight enough around your head, if it's just not positioned correctly, or if you have enough water but you just need to kind of push it against your head a little bit to let that water come out, then it's going to give you a warning. You're going to get like a little flashing light. I'm going to see if I can kind of mimic that right here. There we go. So you'll get something like this, an interruption. It just shows you where it is not able to connect and you need to fix that. So on this one, it is showing that it is the front right electrode. I just randomly moved the device. So I'm going to push it a little bit harder. You may get some water dripping. That's okay. And I'm going to try again. I'm going to push this, which is turning the intensity back on, and it's working again. So I fixed it. Now the intensity will go back to 0. So you're going to have to start all over again. The time still continues, so you don't need to worry about that. You'll see that it's nearly at a minute now, and I'm just having to increase the intensity back to where I want to go. So let's talk about the intensity of the stimulation. So in the clinical trials, people were asked to get up to 40, the level of 40 for stimulation. If you have allodynia, you may find that really hard to do. For myself, I have never been able to get up to 40. Interestingly enough, while I'm having a migraine attack and I'm using that treatment protocol, I can generally get up to 20, 21, never higher than that yet. For the preventive protocol, which I'm doing off-label per my doctor's instructions, I'm only generally able to get up to 10 to 12, sometimes up to 14. And I just want you to be encouraged. That doesn't mean that the device is not going to work for you. It's important to work with your doctor. And I'm trying to figure out a protocol for myself to know how much I can increase that stimulation. So when I first started, I couldn't get higher than 10. Now I can get up to 14. And sometimes, obviously for the abortive treatment, I can get up to 21. So I'm slowly working my way up. I do have severe allodynia, especially around the front of my head. So this is where I tend to have the biggest problem. If you have got this device on and you're making the stimulation stronger and it's starting to trigger a migraine or it's causing pain, that's not what the device is supposed to do. So you can just go back down. You can see here, just push the bottom button and it will reduce the intensity of the stimulation by 1 point. You can go down again. If you decide to go too far, you can just push it back up again. So I just want to encourage you. Sometimes it does take a while for you to get adjusted to the stimulation again, especially if you have allodynia, but that doesn't necessarily mean that it's not going to work for you. So it's very much a trial and error. If you are using it off-label for preventive treatment, you do need to use it every single day. So that's 20 minutes every single day. For myself, I just tend to do it when I go to bed, I'm reading a book or I'm watching a sappy movie, just relaxing. Then I've got this on my head and it's just an easy way to fit it into my day. So just want to encourage you that this is a device like preventive medication. You do have to use it every day if you're using it on a preventive basis. If you only want to use it for abortive treatment, then it's on an as needed basis. I think one of the most interesting things about this particular device is that it is available for abortive treatment, but also they're working on the preventive treatment, and it stimulates both the occipital and the trigeminal nerve. So if anybody has nerve blocks and they're working for you, definitely this may be a great opportunity for you to try this device as long as your doctor says that it is appropriate for you. And what we know is that electricity is to the brain like oxygen is to the lungs. And that's really important to know because this device works on that basis where it's impacting the electricity inside your brain. And it's a whole new concept of neuromodulation, basically. Neuromodulation is great because when you use a neuromodulation device for migraine, you're not going to get the same side effects that you may get from drugs or other medications, even over-the-counter supplements and options that you may get that are not prescribed. And so it's great to have this opportunity to use a device that does not have those side effects. Now, it doesn't necessarily mean that you're going to want to use this device by itself. It may be that this device is all you need for acute treatment and maybe even for preventive treatment. But it could be that you need this as part of your toolbox. For me, this is part of my migraine treatment toolbox. And I'm really excited because every migraine attack that it stops is a migraine attack where I don't have to take medication, where I don't have to deal with the side effects of that medication, where I'm able to save my medications for a more severe attack. And it's too early for me to tell, obviously, if it's going to work preventively, but if it does work preventively for me too, again, every migraine attack that doesn't happen, is a day or 2 days or a week when I don't have to take medications that have potentially serious side effects. So I'm super excited about this device, and I can't wait to see if it actually helps me on a preventive basis as well as an abortive basis.